Well, good afternoon. Yesterday, Ontario declared a state of emergency. As of 12:01 a.m. this Thursday, a stay-at-home order will take effect across the province. Unless it's essential reason, getting food, medicine, visiting the doctors or exercise, going to work, you must, I'm going to repeat that, stay home. It's the law and it will be enforced. I know that essential means different things to different people. We have 15 million people in Ontario, each with their own individual circumstances. So we need everyone to use their best judgment. If you're not sure if a trip is absolutely essential, it probably isn't. So please, you must stay home. In downtown Toronto, it is easy to get essential items online or big box stores. But that is not the case in the vast majority of Ontario. There is no same-day delivery. So we need to make sure people can access to the goods they need through curbside pickup only. This is why we have allowed most retail to remain open through curbside only. Schools in the hotspot regions are closed until February 10th. And anyone who can work from home must do so. My friends, the only way for these extraordinary measures to succeed, the only way to save our hospitals and long-term care homes is for all of us to do what is right and just stay home. These measures are intended to give us the runway we need to get vaccines to millions of people across our province, and we're moving at a rapid speed right now. The General will provide you with an update on how things are going and what to expect in the coming months. We're building the capacity, we're emptying our freezers. Phase 1 of our vaccine rollout plan is already well underway. We've administered over 150,000 vaccines to date, and that is changing on an hourly basis. We now have the capacity to administer 20,000 vaccines a day, and we're working our way up to 40,000 a day by February. While phase 1 of our rollout plan is well in hand, thanks to General Hillier and the task force, we're getting ready for the next phase. Phase 2 will be an even larger logistical undertaking than the first, but we are ready. We need to vaccinate another 10 million people in Ontario, including frontline workers and seniors. Over the next few months, millions of doses will arrive, and we are ready. We just need everyone to stay strong a little while longer. So please, stay home, stay safe, and save lives. Thank you, and God bless the people of Ontario. Now I'll pass it over to the General.
Premier, thank you, and ladies and gentlemen. As of yesterday morning in Ontario, we had received 147,000 doses of Pfizer. And we had used, as of yesterday morning, just over 140,000 of those, and we're continuing to vaccinate people with the Pfizer that we had while we awaited the next shipment. That shipment arrived yesterday, just less than 50,000 doses of Pfizer, and yesterday afternoon and yesterday evening, it was already being put into the arms of people in those first 2 priority groups, those in most vulnerable circumstances and those of our healthcare workers. And we wanted to get it to them as quickly as we possibly could. We have ramped up the capacity to flow the vaccines through the 19 hospitals that are running mass vaccination clinics. We are piloting a project with the City of Toronto and Chief Matt Pegg to open up a clinic on the 18th of January to write the playbook for mass vaccination clinics outside of hospitals to utilize around the rest of Ontario. And while we're doing that, we're running an operation called Operation Remote Immunity, where we are getting vaccines into those in most vulnerable circumstances, particularly in those isolated fly-in communities, some of them along the James Bay, some 31 of them that we want to get vaccinated because of their fragile circumstances. And we started last Thursday with needles in arms and several long-term care facilities in those communities, and vaccinated 47 out of 51 residents, for example, and did more in Sioux Lookout itself with long-term care facilities, and now moving to vaccinate the healthcare workers in the hospital there. All this to ensure that those in isolated communities, and flying communities in particular, have received a level of protection that they have not had till now. And we know that they are vulnerable. We know their medical system is not as robust as we all would like it to be. And if COVID-19 is introduced into their communities, it is going to be a massive tragedy, and that we want to help preempt. We have more than 175 people now as part of our team for that operation vaccinated, awaiting their second needle, and prepared to be the vaccinators and roll out in significant numbers that vaccination program, Operation Remote Immunity, into the 31 isolated communities starting on 1 February. And while we're doing that, we took the Premier's challenge and pivoted what we were doing because of our ability now to move Moderna, which had arrived as of last week, and because of our ability in the middle of the week to move Pfizer from the hospital sites where we receive it. We took the Premier's challenge to vaccinate all of the long-term care homes and the high-risk retirement homes in the 4 areas of Toronto, York, Peel, and Windsor, Essex. We are 75% along completing that mission. Some of the homes will be completed by 12, some of the regions will be completed by 12 January, others 15 January, 16 January, the last one by 18 January, we believe, and we will meet the Premier's challenge of vaccinating the residents and the staff in those long-term care homes and high-risk retirement homes who want to receive the vaccine, and giving them that incredibly greater level of protection and eventually immunity from COVID-19. And while we are doing that, we have continued our pivot to start rolling out the vaccine into the long-term care homes and again the high-risk retirement homes around the rest of Ontario. And we've set ourselves a goal of 15 February that we will have vaccinated with the first needle all of the residents and the healthcare staff and the essential care workers and the essential people in those homes. We will have vaccinated them with the first needle by the 15th of February. That's all the long-term care homes and the high-risk retirement homes around the rest of Ontario, because even though they may not have an outbreak now, in time they would if we can't give them that level of protection that we want to give them. So we are now, with a capacity in Ontario, just with the sites that we have going right now, at least twice of what we have vaccines to administer. And so everybody is working hard, and I know right from the Prime Minister and the Federal Government of Canada, right down to the Premier here on my left and our ministers here, to get us more vaccines more quickly. We are ready to use them, and I talked to the Trillium Healthcare Centre, Michelle, CEO yesterday, Michelle and her team of leaders, and you know, they can ramp up themselves very quickly with the program they are running to do more than 15,000 vaccinations a day themselves. And I saw an incredible program of vaccination where they were actually running 2 lanes, one vaccinating and using the staff from the hospital, one vaccinating using a paramedic team, which would then spin off and be completely ready to open another vaccination site whenever we need that capacity. We have immense capacity. I liken it to an 18-wheeler. We started the motor. We've taken our foot off the brake. We've really not put it on the accelerator yet, and we're only in about 2nd or 3rd gear out of 24 gears to go, and we've already got this immense capacity, which we will expand upon. We have brought the provincial health units with their medical officers of health, all 34 of them across Ontario, along with the CEOs of the hospitals who are running or going to run vaccination clinics, into our complete planning and operations framework, and they are working as fast as they possibly could, both to carry out those missions that we now have and to be prepared when we get more vaccines that show up in the province of Ontario. So our program is running. We're running flat out to make sure that we have more capacity than the vaccines we have, and as soon as we get more vaccines, we'll ramp up either further to get ready for what we call Phase 2. Phase 2 would commence sometime around the end of March or early April, depending on the arrival of large amounts of vaccines in the millions. And what we want to be able to do then is move from the first priority of those in most vulnerable circumstances, because we will have covered most of them and vaccinated most of them, or at least offered the vaccination to them, done the health care workers, and those will be continuing tasks throughout, because people will always be joining those into long-term care homes, or going into long-term care homes, or becoming an employee in long-term care homes, and people will always be joining the medical profession, so we will always be vaccinating some from those first 2 priorities. And then we want to work at the other priorities, and You can see it outlined on the board back here. We want to get at those who are most vulnerable, those in the age brackets, 80 years old and above, and then as we finish vaccinating them and helping get the vaccine to them, working down the age brackets, 75 and above and 60 to 75, and do it exactly that way. At the same time, we want to look after those and get vaccinating right away to those who are disproportionately affected by COVID-19. We are talking about some of the racialized communities, some of the communities around our province where COVID-19, as one of the doctors told me, the neighborhood is is hot with COVID-19. We want to get to those populations clearly. That includes the urban indigenous, and we're working now to how quickly we can get to those populations. And then thirdly, in phase 2, we want to be able to give an incredible program of mass vaccination center support to our essential workers, and whether those are first responders like our incredible police and fire, and all the way through to the farm workers who ensure our supply of food, and many others besides. We're delineating how we will do those things, but we believe, given the millions of vaccines that are due to arrive in April, May, and June, and we've been led to believe by the federal government that during those 3 months we will receive 15 million doses of vaccine, both Pfizer and Moderna, that we will be able to run all 3 of those priorities concurrently, and that's what now the provincial health units, with our support and assistance, collaborating with the CEOs of the hospitals who are running vaccination sites, are now planning to actually be able to go out and execute. And what we want to do is be ready sometime in February to turn that machine on full speed. And that way, if we do get a surprise allocation in any way, shape, or form of vaccines arriving in Ontario that we don't have allocated right now, we would be ready within 96 hours to take those vaccines and start vaccinating people with them based on those 3 additional priorities. We want to turn that machine on and just warm it up and have it ready to go. You know, if something like AstraZeneca should be approved and vaccines arrive, we want to be ready for it. If more Pfizer or Moderna arrives earlier, we want to be able to get into, for example, a little bit earlier, those 80 years old and above. Those who are not in the long-term care facilities or the high-risk retirement homes, because obviously many of them are, but not all, and we want to be able to do our job as efficiently as possible for the people of Ontario. That's what the Premier has tasked us with. That's our mission, and that's what we're doing. Thank you.
We'll go to the phone line for questions. First question, please.
From Lucas Meyer at Newstalk 1010.
Thank you very much. First question on capacity, Premier. The Hospital Association has already warned that they're preparing to move patients in ICU through different regions. I'm wondering if, as a short-term measure, there's a possibility to shift different doctors into different regions so that those areas in the hot zones that are feeling this the worst can get some sort of reinforcement on the staff side, if that's on the table, if that's going to happen, and if that means that we're going to see more field hospitals, and if so, how many?
Yes, I'll answer that question as saying yes. I am going to pass it over to the Minister of Health, but yes, that is our goal, to open up more ICU units in other areas and field hospitals. I'll pass it to the Minister.
Yes, we are looking at building more capacity. We already have built more capacity since last year, another 3,100 beds, but we're working with the hospitals. They are taking a regional approach to shift the loads so that if one hospital is over capacity, that they can move patients perhaps into another hospital so that they can receive the care that they need in ICU. But yes, we do have the ability to move surgeons, for example, from one hospital to another, so that if they're not able to do cardiac surgery in one hospital, they can move to another hospital where they can do that. So we're looking at every possibility that we can to expand our resources and expand our health human resources as well.
Follow up?
Thank you. And on long-term care, and I completely respect the fact that there's this outline for the 21st and for February 15th. Premier, you said for months, we're building an iron ring, and Minister Elliott, you said it yesterday. But right now, there is no iron ring. I mean, there's 40% outbreaks, 200 dead since January 1st. As a short-term measure, what is the harm in bringing in the military, even if it's for a couple of weeks or 3 weeks, just to ensure that all the possible resources are there in the meantime?
Yeah, Lucas, good question. I just got off the phone with the Prime Minister before I came out here an hour ago or so, and he's offered that up. We'll take all the help we can get. I never refuse help. If it's the military, if it's the Red Cross, if it's anyone. As per the Iron Ring, you know, I think the world of the PSWs, frontline health caregivers, the caregivers that go in there on a daily basis. All I'm asking is please make sure you get tested. I talked to all the long-term care homes combined, all 626. The number one priority is to make sure they get tested, test as much as possible. That's how we're going to capture it. It's not coming in through the walls and the ceiling inadvertently through the great frontline healthcare workers or caregivers. It's coming in. The part two to that, we are vaccinating through the great work of the task force and General Hillier. We set a goal of January 21st of the hot areas, hot zones, and hopefully we'll be done before the 21st. So those are the key areas. If you want to stop this, go to root cause. The root cause is this virus. So it's absolutely critical, to the point I'm even putting security guards within these long-term care homes to make sure every person that comes in gets checked, to make sure it's documented when they were tested. When was the last time they got tested? And if they haven't been tested, then they can't come in. Simple as that. I'll pass it over to the Minister of Health.
Well, the vaccinations are the best way to provide that iron ring, but I certainly agree with the Premier that frequent testing is also really important, and that has been amplified significantly in the last several months. We need to make sure that every caregiver that comes in, every staff worker that goes in is tested so that they don't bring it in inadvertently with them. We need to protect those residents, and as we get to the testing, we hope to have everyone tested by February 15th, I'm sorry, vaccinated by February 15th with at least the first dose. And that will be followed up with the second dose in due course. But in the meantime, we need to make sure that we do that testing on a very frequent basis. We do have the security people there to make sure that people are tested, that there isn't anyone that's allowed to come in that doesn't get that testing. The rapid testing is coming in as well, and we're going to continue to do that until the residents have all been vaccinated.
Next question.
From David George Kosh at BNN Bloomberg. Please go ahead.
Hi, Premier. Yesterday, following the release of your restrictions and the new state of emergency announcement, the Canadian Federation of Independent Business President Dan Kelly said that no other province has locked down small retailers while handing huge competitive advantages to big box stores. I'm just wondering if you could comment and provide some sort of thoughts on the impact that your new state of emergency will have on small businesses across the province.
Well, I've heard Dan many a times say that at the end of the day, we need to crush this virus one way or another. It's about movement, going from place to place to place. We have put in a lot of help for the small businesses. It's opening up this Friday, the portal. So if you're a small business, please apply. Starts at 10,000, goes as high as 20,000. We're also, through the partnership with the federal government, we're taking care of 90% of the rent, 65. And to be fair, there's no place in Canada that you can compare 15 million people, and you know, there's nowhere close. We can't start comparing it to other provinces.
Follow up?
Yeah, you know, as a small business owner yourself, I mean, we've been hearing a lot of, you know, comments from small businesses how they you know, are worried that this is an extinction event for their sector, notably in restaurants or other food services or other businesses. But what do you tell a small business owner who's already thinking that this current lockdown period, this new state of emergency, will kill their business?
You know something, my heart breaks for these small businesses. If you talk to my cabinet members, I hate closing down anything, but health trumps that right now. Once you lose a life, it never comes back. We can support these businesses to get back on their feet. There's the difference right there. The health, yeah, there's no second chance with health. With businesses, we'll be there for them. We will support them between ourselves and the federal government. We will be there for them. And you know, if you look at the guidelines are pretty well the same. It's very simple. We're asking people, stay home. There is no confusion here. Stay home. That's the simple message. It's absolutely critical. You want to help your local business? Go online. Don't go to the big box stores. Go online to the small businesses. No one's stopping anyone from going online. Support your small businesses. I've said it 1,000 times. I'll say it 1,001. Support your small businesses. Forget about the big box stores. Very simple. Go support your small business.
Next question.
From Brian Lilly at the Toronto Sun. Please go ahead.
Premier, you're putting a big emphasis on vaccination, but I'm wondering, having looked at the capacity that was released on the technical briefing this morning, I'd like to hear from you and from General Hillier. If the Prime Minister did get vaccines tomorrow, if he turned around and said that extra 20 million Pfizer is available and it's arriving this weekend in all the provinces, could you actually deliver it, or would the system be overwhelmed and we'd be sitting being frustrated that we had too many vaccines and not the ability to administer doses?
Well, Brian, very, very good question. Are we ready or are we not? And before I pass it over to the General, the fact is we aren't getting them. I just talked to the Prime Minister. We aren't going to be getting the 20 million doses this week, but we are ready as it escalates, and I'm going to pass it over to the General. He's in charge of that, and he understands the plan.
Premier, thank you, and thanks, Brian, for the question. And so it's theoretical, so I'm not answering on 20 million. What I'm saying is this. We have the 19 vaccination sites with the hospitals running now. We have, as I mentioned, the City of Toronto setting up a pilot project to run a vaccination site outside of a hospital, low level to start with, but prove the concept and give us a playbook for lessons learned to share around the rest of the province. We've got teams from the provincial health units, specifically in the 4 regions of Toronto, York, Peel, and Windsor-Essex, going to long-term care homes. And we've got teams now started going to long-term care homes around the rest of Ontario. Our capacity in all of that we could ramp up within 72 hours would go to 50,000 needles in arms per day. We are confident that we could do that much just with the vaccination sites that we have now. And then obviously, as we roll out across Ontario, each of the 34 provincial health units is perfecting their plans now. They're bringing them forward to us next week to go through with them and say, yes, it fits perfectly within our concept of operations, and now we can work together to do it. And what we're asking each of those 34 provincial health units to do, each of them is at a base be able to do 10,000 vaccinations a day in their area of responsibility. And obviously in some areas, like here in Toronto and Southern Ontario, Kingston, Ottawa, where there is a greater population concentration, North Bay, Sudbury, then clearly we would want to do more than that, and we know that capacity is there. So what I can tell you, Brian, is this. We can ramp in 96 hours, we could ramp up to 50,000 needles in arms per day if we had the vaccines to do it. And within a week after that, we could ramp up exponentially more than that if the vaccines showed up. So we're turning that machine on. We're doing both live runs and dry runs of vaccination sites over this next week's here to make sure that we are ready. The provincial health units are getting themselves completely ready, as they already conduct vaccination operations in those long-term care homes, in some cases just starting, but other cases having done it now for a weekend more. We have an immense capacity, and we've barely started. We could easily, in 96 hours, go to 50,000 vaccinations per day, just with the sites and the capacity that we have now without adding to it.
Follow-up?
Premier, I'm wondering if you broke some news without realizing it when speaking with Lucas Meyer, because I don't recall you saying the military would be coming back to Ontario's long-term care homes in your opening statement, but in response to Lucas's question, you did say that the Prime Minister had offered the military to go back into our nursing homes and that you never turned down help. So Are we going to see the Canadian Armed Forces back in select nursing homes in the next week or in coming weeks?
He has offered any help we need to secure the long-term care. We're working collaboratively together, very, very well together. And I want to thank the PM for his collaboration. The last few words is anything I can help you with long-term care, be it Red Cross or anything else, will just give me a call. So I never, ever refuse help. The more, the merrier. So we'll deal with that. And I'll take all the help we can get right now.
Next question.
From Colin DeMello at CTV News. Please go ahead.
Hi, good afternoon, Premier. This is a question for you and the General on vaccines. Some frontline healthcare workers and doctors are pretty upset that non-frontline healthcare employees, including some who've been working from home, have been getting the vaccine ahead of workers who are dealing directly with COVID-19 patients. I'm curious as to why this is happening and how this is acceptable.
Well, I'll pass it to the General, but again, the frontline people that are dealing with COVID should be a priority. I'll pass it over to the General.
Premier, thank you, and thank you for the question. We have established very clearly the priorities as directed to us by the Government of Ontario, those in most vulnerable circumstances, and clearly we're talking those in congregate living in long-term care homes and high-risk retirement homes who are in communal living, communal kitchens, more than one per room, and particularly are in the hot zones right now, and then the healthcare workers. We've provided a framework, which is a guiding document to the vaccination site CEOs to say this is to guide you in breaking down those healthcare workers. But what we have said to them, and I have said it, is speed trumps perfection. We want to get the vaccinations done as rapidly as we possibly can. At the front part of it, we had some challenge in getting long-term care homes, essential caregivers, and healthcare workers to come to the vaccination sites and get the vaccine in first priority and in the numbers that we wanted. And because once we had opened those Pfizer vaccines and we could not move them at that stage, we did not want to waste them, obviously, and so we started vaccinating the healthcare workers. In some cases, those who were probably further down the queue, as you articulated, got vaccinated before others. Each site has been working to make sure that that happens in as small numbers as possible, but it will continue to occur. When you're vaccinating 165,000 people and going upwards to millions of people, those things will change out. But within a week or 2 weeks or so, we will catch up with those higher in the priorities and get them vaccinated also. I've told the CEOs running the vaccination sites, I've talked to the medical officers of health for the provincial health units across the province and said, you roll out the vaccination program. We know it will not be perfect. These are the guidelines to internalize them, study them, utilize them, and ensure that as best you possibly can while running an effective operation, these guide the operation completely. When there are missteps, I will have your back. I will take responsibility for it because I'm urging them to speed. We will have some missteps, I'll call that like that, and we'll catch them up really quickly, and meanwhile, we'll roll on as fast as we possibly can. So it's not ideal. An operation of this size is not going to be, and we're not going to make apologies for that because we want to get the vaccination to folks in an incredible hurry. And now, with Moderna, which we can move, and with Pfizer now being able to move it, we are going into the long-term care homes, and we're doing not just the residents there, and ideally we could do this in one visit or with the healthcare professionals in the home in one visit to augment what they can do, to vaccinate the residents, to vaccinate the essential caregivers, the staff, and the healthcare workers who work there, all in one package, so to speak, so that we are actually getting to that population that we wanted to first most to start with. Thank you.
Follow-up?
Thank you. My follow-up is to the Premier. Premier, just talking about the enforcement of the stay-at-home order. You've often said that you can't police 14.5 million people. Now you're saying police will be enforcing this order, handing out fines and possible jail time. The pandemic has affected lower-income communities harder than others. So how do you ensure that these communities will not be over-policed during the stay-at-home order? And if a police officer were to stop me or somebody else to ask, why are you out of your house? Am I compelled to answer them, or can I just simply walk away and ignore police?
I'll pass to the Solicitor General, but the message is very, very clear. Stay home. That's it. Stay home. And you know something, I think we have the greatest police anywhere on earth, right here in Ontario. They're reasonable, they're thoughtful, they know the situation, and I'll pass it over to the Soljan.
Thank you, Premier. So to be clear, the police have been enforcing the orders under the Reopening Ontario Act already. Since March, we have had Ministry of Labour employee inspectors out in the manufacturers and businesses, ensuring that they are complying. We have had police and bylaw officers asking people to disperse and laying fines when appropriate. The Reopening Ontario Act is very clear that if you are not at your place of residence, and you need to be fined or you will be ticketed as a result of the orders, they have an obligation to ask for your name, date of birth, and address to lay that ticket. Thank you.
Last question.
From Stephanie Smythe at CP24, please go ahead.
Hi, Premier.
Stephanie.
I just wanted to follow up on Brian's question, which was a follow-up to Lucas's question about the military and long-term care. Are you calling in the military to long-term care homes in Ontario? We have over 3,000 deaths now in long-term care. If not now, when?
Well, Stephanie, I just got off the phone with the Prime Minister. I will reach out to health and long-term care, and they're going to make that decision. We need all the help we can get, so I'm not going to refuse any help when it gets offered to us. So I'll take them up on that offer, but I just want to make sure once they come where they're going and where we're needed most.
Follow up?
So could they be coming this week?
I just got off the phone with the Prime Minister an hour ago, Stephanie, and I will leave that up to health and long-term care to see how quickly, and I always believe we need them quick, to see when they can come in if that's required. In my opinion, some homes it's required.
Thanks, everyone.
And I just, before I go here, you know, I hear there's a little bit of confusion on the order and everything. There is no confusion. I hear some elected officials, local ones and other ones, oh, it's confused. Folks, there is no confusion here. It's very simple. Stay home. Stay home. That's it. If you're questioning, should I go out? You got the answer. Stay home. Restez à la maison. That's simple. And it's very, very simple. Stay home. Stay home. I don't know what more I can describe. And for anyone who says, or elected officials, you aren't being responsible. Be responsible. The message is simple. Stay home. There can't be any clearer than that. So thank you, and I appreciate everyone's support. Staying home, stay safe, and save lives. Thank you.
Thanks, everyone.